We have built a program to treat those patients, and we started in 2010, well 9 rather. And the essential part of this team is an independent, very active, small nursing team.
Nursing in the VAD service has evolved over the last 10, 12 years to a point where we are doing our own nurse-led clinics. We are the consistent part that is there with the patient from the very beginning to the very end. So we meet the patients pre-op, we help assess to think if they are a candidate for VADs, we talk about what life is like with a VAD with them and try and introduce them to patients so they can get a bit of a feel for it.
They're involved in every single step after the implant. So they're involved in theaters when the pump goes in, they're involved in helping ITU stuff, they're always in charge of the ward care, and most importantly, when the patient goes home, they're running fairly independently the outpatient clinic, and they keep the patient 365 days a year.
It originally started off as one VAD coordinator. The service carried on growing, and one element that was highlighted was the need for proper surveillance of our outpatients. We then developed it to a point where we have been able to move from being telephone-based to app. And the app service was developed purely in-house by the nursing team. The
main purpose of the app and of the outpatient service in general is to be proactive so that we can manage patients at home as best as possible, not bring them into hospital unnecessarily. It's very patient-centred and patient-focused, so because we speak to them so often, we can pick up on any little issues that they may have. I think it definitely improves the patient's quality of life and keeps them at home.
I always say to patients when we talk about it as a pre-implant side of things, you'll have this device put in and then you'll speak to us more than you'll speak to some of your family.
The hours were always available to be a Schueler, a cryo, really. You know? Over the years, they've become part of the family, you know, really, haven't they? You know? And that's it. You know? You can't really see them more than that.
So we've developed the wound management of the dressing, the INR management, education for the patients. We also deliver education outside of the hospital and we'll do in-house education as well. So we're a small part in the team, but I would say we're quite a crucial part of it.
It's very in the future looking. It actually also points towards a completely new role of nursing. Highly specialized, subspecialized even, and very responsible for patients' lives and quality of lives.